Welcome to another edition of Coffee Convos. I'm Dr. Matt. Today we're at Revelator Coffee, enjoying some Lonely Hunter from Revelator Coffee Company. A big thanks to Maggie for our pre-show spro. So, what are coffee convos, you ask? They're conversational topics that have some tie to physical therapy, health, or wellness. And occasionally, I hope to bring on some people to help facilitate those conversations when the topic at hand is out of my area of expertise. So recently I've had a few patients ask me, Dr. Matt, what are the best pillows to use for sleep, or what kind of mattress should I buy regarding back pain? And I didn't really have a good answer. So today I'm going to kind of take a step back and go larger and talk about just sleep hygiene in general, and we'll kind of run back and kind of answer that question a little bit more fully based on what some of the research shows us. So, sleep hygiene is defined as good sleeping habits or any pre-sleep rituals that improve your sleep quality. So, what I want to do, there's a lot of information out there. I want to kind of synthesize it, and I want to think about sleep. So, an acronym, THINK. So, having proper sleep hygiene to increase your sleep quality and possibly decrease your pain will improve your overall health and your overall lifestyle, because you feel better, you feel refreshed, and you feel ready to take on the day. So without further ado, let's think about sleep hygiene. So the T, take a hot shower. Hot showers can increase your body temperature, and then when your body temperature comes back down, it has that relaxation effect, and so you feel a little bit colder and you feel ready for bed. And so other than taking a hot shower, you can utilize pre-bed relaxation techniques, whether that's drinking hot tea, reading a nice book, or just changing into your favorite pajamas and getting comfortable. And so just remember to think about sleep hygiene, and so T, take a hot shower. All right, the H in think will be to have a bedtime snack. There's research out there saying which foods are best based on their melatonin levels or their tryptophan levels, and so look into some pre-bed snacks that might help your sleep quality. Another thing with having a bedtime snack, it doesn't need to be too much, right? You don't need to be so bloated that you can't go to sleep, right? But the same is true, that you don't want to go to bed hungry. You don't want to go to bed on an empty stomach, and then you're thinking about how hungry you are when you're lying there in bed, right? So try and utilize a bedtime snack. The I in think will be to institute consistent wake-up times, even on the weekends, right? And so that's going to get your circadian rhythms in sync throughout the week, not just throughout the weekday. And so if you think about that, if you're sleeping, 10 hours on the weekend, and then you don't feel rested throughout the weekday because you're getting 6 hours, right? You can really kind of alter, back and forth. And so having consistent wake-up times will really kind of put your body into the normal rhythms that it needs to, and those normal sleep cycles to get the adequate amount of REM sleep every night that you need that will help your sleep quality. So I institute consistent wake-up times. The N in think would be nothing but sleep or sex in the bedroom. And so don't have any electronics in the bedroom. Don't charge your phone in the bedroom. Don't even have a TV in the bedroom, right? Just preparing for what the bedroom is for will help your sleep quality. And so consider getting some plants for the bedroom to kind of improve that air quality, really just focusing on your sleep. So just remember, in nothing but sleep or sex in the bedroom. K, know that your daily routine will affect your sleep quality. The amount of exercise you get in the day can affect your sleep quality. Getting afternoon sunlight can affect your sleep quality. And napping in the day can help get that adequate extra REM cycle if you need to, but don't over nap, right? If you've slept for 3 hours in the afternoon, don't be surprised when you can't really get to sleep that well. So know that your daily routine will affect your sleep quality. And so even if you take all those other tips and you're still kind of fighting to get to sleep, you're still kind of restless, what did you do in the day that could have affected your sleep quality? So think about sleep quality. T, take a shower. H, have a bedtime snack. I, institute consistent wake-up times. N, nothing but sleep or sex in the bedroom. And then K, know that your daily routine can affect your sleep quality. So to circle back to this question that I've been asked in clinic, is that research showed that a medium to firm mattress would be best for decreasing back pain and increasing function. So just know that if you have a nice mattress that supports your spine, that gets you a good night's rest, and that is not 9, 10, 12 years old, it's still a fresh mattress, that it should be good for you. And that's the thing I want to drive home, that whether mattress or pillow, you need to tailor it to your needs. And so if you're a stomach sleeper, a really tall pillow might not be best for your spinal position. So just know that if you're sleeping on your stomach, you need a really thin pillow. If you're sleeping on your side, you might need a larger pillow. And if you're sleeping on your back, you might need somewhere in between. And so you could utilize a pillow in between your knees as well if you're a side sleeper. And so all these different factors based on your individual sleep patterns, your individual sleep position, will dictate what kind of mattress or what kind of pillow you need. Whew. What about some of the weaknesses of talking about sleep hygiene? Is that if you're not getting good sleep and then you're starting to implement all these different tips, you might start to stress about your lack of sleep, or you might watch the clock and diligently track how much sleep you've gotten. And that consistent thought about sleep or the lack of might kind of have a psychological component and might limit your sleep, right? So take these tips with a grain of salt, try them out, see if it helps, but don't worry if they're not effective for you, okay? And so lastly, before we kind of transition, is that what are the opportunities for the profession? I think that asking questions about sleep opens the door for all facets of recovery. So sleep is kind of the window into the topics of rest and relaxation, that if you have a patient that's in pain, they are very limited in their ability to rest and relax. And so they might have terrible sleep hygiene, so talking with them about sleep hygiene might give them the small little tip that they need to get just a little bit more sleep and drastically improve their day-to-day life. So thanks again for listening to this episode of Coffee Convos, where we talk about sleep hygiene. So once again, a big thanks to the folks at Revelator Coffee for allowing us to use their space to bring you today's topic. As always, comment if you have anything you want to add to our Coffee Convo. Send us a message if you want to dive a little bit deeper into the topic of sleep hygiene. And give us any suggestions about what you want to hear us talk about next. Feel free and please do share this video so that we can reach more people. Be sure to like the Dr. Matt Facebook page and follow along with all of our other content. Thanks.